So this is the Littleton Board of Health Wednesday, March 3rd, 2021 virtual Zoom meeting. I'm just going to read the Zoom rules. The town of Littleton began conducting remote participation / Zoom meetings pursuant to Governor Baker's emergency order suspending certain provisions of the open meeting law on March 19th, 2020. Since that time, unanticipated legal concerns relating to the open meeting law have been brought to our attention by the town clerk. These concerns are supported by the Attorney General's office and confirmed by town council. One concern is that the chat function allows a parallel text conversation to a board's public meeting. Chat is essentially running a commentary that is occurring, but is not moderated or followed by the chair. All participants and listeners may not be aware of the comments being made because some meeting participants join by phone and do not see these conversations. Another concern is conversations between residents within the chat room, which are not incorporated into the public record. In response to these concerns, the town will implement the following changes, which in no way prohibit any member of the public from participating in discussion and sharing information during a public meeting, and will ensure that all listeners and participants have equal access to this meeting. People that join the Zoom meeting are set so their microphones are muted. If you call in by phone, please use *6 to mute or unmute your phone so that the meeting can occur in an orderly fashion. We ask that people who join keep their microphones on mute so background noises do not interfere with the meeting. If you wish to participate in the meeting, please use the raise your hand function available on Zoom, or if you've called in by phone, dial *9, which will activate the raise your hand function. The meeting host will notify the chairperson of the raised hands, and the chairperson will determine whether and when to allow public comment. When called upon, participants should unmute, then state their name and address. After speaking, we request that the participant return their microphone back to mute. So I said this last week, March 19th. That's not that was a year ago. Crazy. So, hi, Janet. So there's kind of a short meeting tonight, so we'll start with the COVID update with Jim. Hey, Jim.
Good evening. So I just want to go through some of the changes from this past week. On March 1st, last Friday, but on March 1st, a bunch of changes went into place. Most of them have to do with the capacity of spaces, and probably the most significant one is the changes made to restaurants. Restaurants don't necessarily have a set capacity anymore other than their license number, and more importantly, the spacing between tables. So to make sure that they are doing the spacing that they need, we're going to go out and have the food inspectors go out and make sure the table arrangements are such that they're meeting the requirements that are now in place as far as having the tables at least 6 feet apart. Reinforcing the 90 minutes kind of timeline for people at the tables, that there's no more than 6 people at a table, just and check bar areas and stuff like that, just to make sure they're complying with those requirements. That's probably the most important, because there's not a set capacity. It's really important that they understand those things that control capacity in a space. As far as trends go, it looks like Littleton is kind of like the Commonwealth is trending down and maybe leveling off. I don't know, the past 2 weeks, the numbers seem to be about the same, the 2-week rolling. The town is now, as of last week, was in the yellow, which is good risk-wise. The same thing with the state. The state has been dropping down. It looks like it may be either continuing very gradually down or maybe leveling off. I guess one of the more significant things I saw on the daily dashboard is that the number of active cases in the state, so that's defined by the number of people who have 21 days ago had a positive test, is about a third of what it was. It's 30,000 as opposed to 90,000, which it was in January. So that number is down significantly. Starting on March 11th, the governor announced today that teachers can make appointments to receive vaccinations. I'm hoping that by March 11th, they find a whole lot more vaccines, so maybe teachers can actually get appointments for vaccinations.
Yeah, I heard he's warned everybody. It's still limited.
I'm happy to see that they're opening it up, but I'm concerned that unless there's more vaccine out there, that there'll just be more frustration with trying to register for an appointment. So I hate to say it that way, but it's I haven't heard anything on the horizon that's good as far as supply. They're still talking about constrained supply at the state level. And according to the governor's press release, that was teachers that was health, childcare workers, that was school staff. So they estimate between 300 and 400,000 individuals would become eligible for vaccinations starting on the 11th. And then on the public health call that we had on Tuesday, one of the 2 weekly calls, the state provided us some information about how we might go about vaccinating homebound individuals. So we need to, we, the boards of health, and I'm working with Tamara, our nurse, need to come up with a plan of whether we're going to try to accomplish that ourselves, us being the Board of Health, which I think we're leaning towards. The state is also offering a service with a mobile vaccination process. So, I mean, we're thinking that we would like to try to do the homebound ourselves. They have come out with some information about definitions for homebound, just to make sure that we're all on the same playing field. As we work on that, working with Tamara, we have to let the state know next Friday, so the 12th. I will probably be in touch with some of the local council on agings just to get a sense of how we might approach that to determine who the homebound are. And that's what I have for a report.
Great. Does anybody have any questions for Jim?
Just want to make sure that Jim does not own stock in Moderna.
No, I wasn't smart enough to get any of that ahead of time.
No, I'm teasing you. Okay, obviously.
I tried pumping you for information in the spring.
That's right. There may have been a whole lot more retirements had we all knew, right?
Oh, no.
Hey, Jimmy.
Yes.
How many people will you be able to vaccine on that particular date?
On which day is that, Gino?
Whatever day you allow.
So again, we're just finishing up with the people we started with. So we the Board of Health, the district, have 2 more district clinics to complete second doses for people we gave first doses to. So,
Okay.
and we haven't gotten confirmation yet that we're going to get that vaccine for our clinic next week. We are crossing our fingers because the state keeps telling us that they're prioritizing second doses. So we're hopefully taking them at their word and hoping that vaccine comes in time for the clinic.
Oh, that was good. Thank you. Thank you.
Yep.
Great. Thanks, Jim.
Yep.
Is Katrina, well, let's get Scott. Scott, are you here tonight for an update? Do you have anything for us?
Hi, no, mostly I just wanted to hear what Jim was saying. There's definitely a lot going on with the Elder and Human Services, and and the seniors trying to jockey around for appointments. Pretty much the same issue everywhere. I know that at one of the meetings, for Pine Tree Park, they were talking about doing their a small clinic in there for the residents of housing. One of the other updates with that, I've been in contact with a representative from Lowell General, and they are also actually, I believe, meeting tonight, trying to block off small banks for all of the surrounding communities. So that might be, one more option for the town as they go, kind of go forward. Not quite sure how many they will be able to offer out each week, but they're definitely working on that. I think every little bit's going to try to help, with especially with the seniors. It's tough, as the governor said, hey, they want everybody to go to the mass sites, but there's so many seniors that just really, they don't want to leave town. It's a challenge, but
Right.
hopefully, if we're lucky enough for things to ramp up, offering assistance to the Board of Health and, any way that we can try to get it out there. But pretty much like everybody else, hurry up and wait.
Yeah, I went to the Lowell for my second shot last week, and probably like Gillette and Danvers, they're so well run. It's amazing. I was in and out in 15 minutes plus 15 minutes of waiting. So it's a really good site over there too. It'd be nice if they could keep it up.
The volunteer corps, I know, has been helping Jim and the Board of Health at each of the clinics. And it seems as they continue to assist you guys, more and more of them, are trying to volunteer and be part of it. And it's just it's a good feeling of helping out for them. But we'll see what happens with going forward.
Alex and with the Littleton crew and Ron Cisco with the Boxborough crew have helped us out. Now this is, I think, the third time over to Devon's, in addition to helping out with the four first responders clinic, and they really have made a tremendous difference in how well it's run and how professional it is, and kind of the home touch it has to the people who are coming through the clinic. So, hats off to them for him and the volunteers of both of their groups. How nice a job they do.
Thanks.
Is there anything we can do to help with the elders at all? Do you guys think should we reach out to them, or do they get it like just to broadcast things or call it to people's attention? Or
right now, as I get information, from other sites, I try to pass that off to Ashley at Elder and Human Services so that they can at least. The other day, they were able to sign some of the seniors up for the Lowell location. I'm not quite sure how many they actually got, but we kind of get a quick blast that'll we'll say, hey, we have several openings, and obviously it goes to many towns, or basically all the surrounding towns from Lowell, and kind of on a first come first serve. But it's just as you hear the different locations and what's available, we try to get that out as quick as possible.
Yeah. So you guys are doing it. It would be a wasted step if we were involved, probably.
I think you really want, town had great intentions in the beginning at creating a list for, the hopes that we would have a clinic. Unfortunately, the governor changed his mind on that, and now they're trying to assist those individuals at booking in any other location that they can find.
Oh, okay. Those 600 people.
Yeah.
Yeah.
Unfortunately.
Okay. All right. Anybody have any questions for Jim or Scott? Go ahead, Louise.
So just about the booking for an appointment for a senior, so they can call Council on Aging and get help with that?
I'm not exactly clear on it, but I know they were offering assistance for some of them in trying to book some of the appointments. Some of the individuals don't have either the ability to stay on the phone or computer access.
Right.
So I know they were trying to assist and at helping some of them out with the booking and reservations, but they definitely, there's a significant frustration out there with the lack of availability or the time that it takes. So when we have the opportunity, such as the Lowell one, that for the surrounding area, hey, all of a sudden there's some availability, they try to jump on it, and they've had some success, without waiting for significant periods of time.
Oh, that's awesome. I just don't want to go around and say, hey, you can call the Council on Aging for help if you want, unless it's true,
No, I wouldn't. If everybody could really do their due diligence and really, contact be diligent with the state site. Everything is opening up as they release different amounts. Sorry. But they the different sites offer the different amounts as they do the release, but obviously the whole state is jumping on that at the same time. So if we can get some of the local site to or find out the little tidbits here and there when they do a quick release, we can try to jump on those before it really gets public and out there. But
that's great. Thank you.
Is anybody using the state helpline, the 211? You think Health and Elder and Human Services are using that at all, or recommending people using that? Have you heard
I
of
know
that?
they were attempting to have any of the individuals that we were capable
Mhm.
to do whatever they could to arrange for appointments. But honestly, I'm not exactly sure what they're capable of within the Elder and Human Services
Mhm.
for scheduling.
I heard on the news this afternoon about a woman who organized her Facebook group of moms that, you know, coordinated to try and find the seniors some appointments. So I don't know. It was just on the news, so I have no idea how you go about doing it or not. But all right. Anybody else? Questions for Scott or Jim? And Janet, anybody in the? No. Okay. So Katrina, do you have some update for us too? Hello.
Hello, everyone. Sure, I'll give an update. It's been, 2 weeks, so we'll get the true update. All right, there are my slides. So, come on. So here are the 4 main metrics that the state puts out on the main page of the daily update. This is from the beginning of this is a whole year of experience, essentially. So there, as you can see, we've recently dipped down. We're about the same level where we were at the beginning of November for almost everything. So it's great to see that these numbers came down, but if you zoom in a little bit, they're kind of leveling off. So I want to go through that a little bit. So we're going to start with testing. So this is the number of tests over the last 6 weeks, this graph on the right. The testing levels, thankfully, have been really stable, even over vacation week, the school vacation week. So that's really great to see. There was a little bit of dips around the 3-day weekend, but that's expected. We get that every time. The graph on the right is the test positivity over the last 6 weeks. And you can see that we hit our high and we came down. 2 weeks ago, it was 2.3% across the state, and now it's 1.8%. And that's, there's a slowing of the decrease, that it's not, it's kind of continuing down, but it's definitely leveling off. We're not in that free fall that we were at the beginning of February. So that's something to keep an eye on. These are the number of cases. This is, again, that 6-week period. The number of cases are actually, again, you can see that the rate of decline has slowed over the last week and a half or so. The 14-day statewide incidence rate is 21.3 this week. A week ago, it was 23.3. And in my job, that's essentially equal. So again, the rates stabilize. We're kind of in a pause at this point. So hospitalizations, again, that's a lagging indicator. So the 7-day average has trended lower, and it's now about 800 hospitalizations a day. That's a similar level to right around Thanksgiving. Hospital and ICU capacity have also improved, or actually it stayed the same compared to about 2 weeks ago. So 86% of hospital beds are occupied and 73% of ICU beds are occupied. That's similar to 2 weeks ago, but they've clearly improved from the beginning of the year. And in the last 1.5 weeks, the number of deaths has stabilized. The 7-day average is about 40 deaths per day. That's a similar number to what we were seeing right around Thanksgiving. So like you said, both of these are a lagging indicator, and they follow the cases. So the cases went down and then have kind of paused right now, flat, stabilized. Will be interesting to see what happens to these two over the next week or so, and see if they continue to go down or if they're going to stay stable. Hopefully they don't go up. So the state is now preparing a report about vaccinations weekly. This is the report from last Thursday. They release it every Thursday. Around 6% of residents in our state have been fully vaccinated with 2 doses. While around 14% have received their first dose. This is the graph on the right, is the first dose. And as Jim mentioned today, the Governor Baker is really emphasizing that while they've opened up vaccinations to more people, like the teachers will be in a few weeks, we're not getting the supply we need to meet our demand. So the good news is we have high demand in our state. The unfortunate news is that we aren't getting the supply to get that out quickly. So as supply increases, well, hopefully, I know they have capacity in the system to increase it if people can get to the vaccination sites. So hopefully, as everyone pointed out, we can get some local sites back up and running. The things about vaccination programs is you can have supply, but if you're not getting them into arms and into the right people's arms, you're not really going to reduce disease or spread of disease. So that who is being vaccinated is just as important. So you can know who to target or to help with messaging and things like that. So these are 3 charts that the state provides that kind of gives you an idea of the demographic characteristics of people who are vaccinated. So this is among those vaccinated, this is the proportion in categories. So the age distribution, which is the top one here, the fully vaccinated very much look like who has already been allowed into the vaccination program. Is really majority of them are between 30 and 64. And that makes sense when you think about healthcare workers, first responders, who was in that first round and have had a chance to get fully vaccinated. And then you can see the first time first received the first dose, there's a higher proportion in the older age brackets. And that's because we opened it up 75 plus and 65 plus 2 or more comorbidities came next. So that's why that proportion of people is older. So as we open up vaccinations, you're going to expect this to start reflecting age distribution in our state. So of those vaccinated, interestingly, about 2/3 are female and 1/3 are males. So it'd be interesting to know why that is. And then race and ethnicity distribution, we've got, again, 2/3 are white, and then about 5% are Black, and 4% each for Hispanic and Asian. So I know there's been some work in the cities and in some more racially diverse areas to try to access people. The governor's been meeting with smaller groups and getting people in there to help with that messaging. So hopefully this will improve as the weeks come along. So let's go to some local stuff. So just to remind everyone, Littleton's denominator that is being used is actually under 10,000. And I know I heard people were like upset that it took us a little extra time to get in the yellow because of this distinction. But if we ever get to go to the green, we're going to be happier because it would be really hard for us to get in the green for the 10 to 50K group. So I think given that number, we're actually in a group that's appropriate for our population. And also I hear a lot of emphasis on what color classification we are, and that's an easy way to kind of group us. But when anyone's making a decision about reopening or things like that, it's really important, in my opinion, to really look at the trend lines and how steep they are changing in what direction. So it's more meaningful to focus on those pieces of information when you're talking about reopening kind of decisions. But it is great that we were in yellow last week. So this is last week's weekly Dph report. Last week, Littleton had 20 cases reported. And that was for the period of time between February 6th and 20th. The 2 weeks before that, we had 44 cases. So that was a big decline. That was nice to see. And then the 20 cases puts us about in the same number we were seeing in the mid-October range, which is, it's kind of nice to get back before Thanksgiving at this point. And this is the rates per 100,000 in all those areas that we track. Littleton's rate was 14.6 per 100,000, and that was lower than the 2 weeks prior to that. The trends across the state, the county, and all the areas we track have also trended lower in the same direction and about the same pace. So again, everything was a nice decline as of last week, or February 20th, I'm sorry. So tomorrow's report will go through February 27th. And given that the state's case rate has kind of leveled out, I'm expecting to see a similar trend where things kind of flatten across all these areas. So we'll see if that holds true when the report's released tomorrow. So this is the total test positivity graph. This is, again, remember the number of people who test positive over the total number of people who were tested in the 2 week period. The number of tests conducted for our town was slightly lower than it was in the prior 2-week period. We had about 1,200 tests, but our test positivity was 1.79. That's similar to where the state's is right now. So those are good. And again, we tracked similar to the other areas that we track. So this is Jim's sneak peek that he sends every Wednesday. It kind of gives us the idea of where we're headed and where the report tomorrow will be about this number of cases. So Jim shared today that there are 17 cases for the second week in a row, actually. So again, that's that flattening that we keep seeing in space over like multiple ways. I looked at all the other towns that Jim, Neshoba Associated kind of cover, and they were all also fairly stable. So again, that's that leveling off we're seeing across the state is also happening in our local and regional level. It's another sign that things aren't continuing in the way that we've enjoyed over the last couple months. So we've got to be careful at this point. I know you guys are interested in school stuff, so I'm going to quickly review that here. This graph is all of the health notification letters that Littleton Public Schools send to parents, updated as of Tuesday. In total, we had 39 cases reported. And as expected, the number of notifications decreased as our town rates decreased over the like February, basically. And these cases, when you look at it by school, are spread out over all the schools. So there's no one school that's having a bigger issue than others. They're pretty equally defined. And they, as of last Friday, they completed their second week of pooled testing. And that is one of those kids is my son, who was participating in the program. Both my kids tested. They were nervous going in, but they said it just tickles and it's easy, quick and easy. So they had no problem with it, which is awesome. The nurses are doing an amazing job. Littleton Public Schools reported about 60% of students and staff have consented into the pooled testing process. So that's a decent number. That's a good consent in for 2 weeks. They're hoping that number will continue to increase over the next few weeks. They did last 2 weeks of testing. There were, I don't remember how many pools were tested, but there were 0 positive pools among all the pools that they did, which is amazing as well. So what I'm really hoping with all these changes for schools and reopenings across the state and things that I think this data is going to be really helpful to help the schools navigate whether to be open, closed, how to like react to things. And so I really hope more people will consent in to the program as time goes on and kids get more comfortable with it. I know they're doing an open forum to answer questions for parents tomorrow. So I'm hoping that will really help things. And then Lisa, last time I was here, you asked how the schools were, how you asked what the school pooled testing data and how is that going to get incorporated into the town level data, which is a really great question and I wasn't able to answer it. And Lynn Snow at the schools has been a wealth of information and what she doesn't know, she goes and asks, which has been amazing. So if you ever have a question, contact Lynn Snow. But we found out from the people at CIC who do our testing that the pooled PCR testing data is actually considered screening testing. So that tells the school if someone in a pod of like a sample of 10 will say if somebody in that is positive, but that's not a diagnostic test. So that does not get incorporated into the town statistics. So then the schools, if there's a positive pool, will take and reflex test all of those individuals using the BinaxNOW rapid test. And then to figure out which individual is positive, and the combination of the positive pool and the BinaxNOW test is enough to be a diagnostic test. And so that one positive case would be incorporated into our town numbers. So that means, so at last week's school committee meeting, there was a concerned parent who was wondering how this was going to be incorporated in, and if we were finding cases, would that count against school reopening discussions, things like that. And I'm not sure he fully answered her question last week. And so I've been really thinking about it this week because I think it's important. It's a really good question. So I kind of modeled it out. And when I was thinking about it, it would take a lot of positive tests in the school to raise our test positivity over the 5% testing positivity. That's like the same threshold the CDC uses too. And that's really unlikely to happen in the schools. But if it did happen, that means we're having an issue in the schools that really needs to be addressed and taken care of. So that would warrant action on the part of the schools. And also remember that our town is classified under 10,000. So that means the test positivity, which people would want all these tests to be incorporated in a test positivity to drive it down. But that metric isn't useful for our town because we're less than 10,000 people. So that's not a big deal. So then I was thinking the next step is if the other metric is the number of positive cases, our color thresholds are driven off case numbers. So if you have a positive case in the schools, it's given household spread. It's likely there will be other individuals who are positive in the household. And so the benefit of a school testing program is that we identify a case quickly. We hopefully isolate through close contact and quarantine efforts the family or any other close contacts, and that would help break those chains of transmission. And that would really help prevent spread in our town. So that early identification is a real benefit if more people are participating in the program. And if you have a quick uptick of cases and you react and like they're isolated and they're not spreading around town, then you should also have a decline in cases 2 weeks after that. So that would be doing what it's supposed to do. It's a mitigation effort. If there are cases being transmitted in school and we find out through testing that a number of our cases are actually happening in the school testing, that's exactly what we want to do pooled testing for. It would help the schools to identify the problem, work with Jim and his team, trace it and react to it. And again, that helps to prevent further spread in the schools and also prevents further spread in the community. So again, that scenario would maybe create a temporary increase in cases. But again, if it's happening in the schools, we need to react to it anyway. And then if it's contained, it should come back down quicker than if we did nothing. And then conversely, if the number of cases in our town are rising, but we're not seeing them in the pooled testing, then, and the pooled testing program remains robust and ideally 60% or more are opting into the program, then that really gives us confidence that it's not the schools that need to react to the rising case level for the town. So that helps us remain confident that the schools still remain safe and we're not having transmission, and that there might be other areas in town we need to put focus into preventing spread. So her question was a great one, and I'm glad she made me think about it, because this made me even more of a passionate cheerleader for people to get into this program, because I think this will really help not only our town, but our schools to really make sure that we're being safe, as safe as we can be. And then it also helps give information for our town, the Board of Health, to make decisions where things need to be made if they're not in the schools too. And then, so a thing about variants, there are a number of variants of concern that we've been talking about. I've changed up my slide. I actually adapted this from the information that Dr. Fauci has presented. This is actually his slide. And I just added, is it in Massachusetts? So the CDC and NIH have started reporting on now 5 different variants of concern that they're tracking, all of which seem worrisome because of increased transmissibility, potential impacts on vaccine efficacy, or that they may evade antibody response with natural or vaccine. The cases of the UK variant and South African variant have both been found in Massachusetts and reported. I just saw this week be reported that of their samples that they've started doing the genetic sequencing on, 5% of them were the UK variant and 1 was the South African variant. And that data just confirms what we expect, and we've heard that these variants are present in our state and they're circulating, and they're of concern. So we need to continue to do everything possible to prevent spread of these more transmissible variants. And the further we drive down cases at this point, and the quicker we increase vaccination rates, then that will give us a better chance against these variants, as well as less chance to have new variants arise. So the public health messaging. So COVID vaccines are an important tool. We really need them to help stop the pandemic. Your best protection is trying to get a vaccine in combination with wearing a mask, staying 6 feet away from others, avoiding crowds, washing hands often. No one tool alone is going to stop the pandemic. None of the vaccines currently in development in our United States uses a live vaccine that causes COVID. So you may have, once you get vaccine, you'll probably have fever and some other symptoms that are related to the vaccination and your body building immunity, but that's a normal vaccination response. And actually, you're helping your body build the tools it needs to fight COVID should you be exposed later on. And so visit www.mass.gov/COVID-19 vaccine to learn more about the vaccination process and eligibility and how to sign up in the state. I know that it's just said that by March 11th, the state will start vaccinating teachers. I know CVS is starting to roll out vaccinations for teachers, I think even a little sooner. So again, it's like check the website frequently, not just this website, but the CVS, I think you can directly check their websites as well. It is cumbersome and annoying right now because there's not enough supply, but you just have to keep checking at this point. And hopefully supply won't be an issue much longer, especially with the J&J authorization that happened on Friday. So we've talked about this before too. One of the easiest things we can do right now is improve the quality and fit of our masks. And it's perhaps the easiest thing we can do when every time we walk out the door. And I've actually been really pleasantly surprised to see a number of people when I'm running errands actually double masking as they go about their day. There's been some really great role models as well. I know Mrs. Temple at Russell Street wears one every day. So it's been nice to see an uptake in the improving quality and fit of masks. We're going to end on the cheese. Things are really changing rapidly here in Mass and across the country. There's a lot of shifting and relaxing of restrictions and on businesses and discussions about opening schools. And it's been a year. It's there's a lot of things shifting and we're ready for it, but things are kind of also slow. Like vaccinations are happening, but the supply is not keeping up with the demand. We're trying. In a few more months will be very different, I think. But I worry what all these reopening signals, what kind of impression that gives people. And I think, and from what I can tell, people are kind of relaxing a little bit and maybe not even realizing they are. So with our case rates flattening over the last week and a half, we're really at this like point in time where things will we're just at a pause and they'll keep going down, or we're pausing and we're actually turning in the other direction to go back up. So the next week or so of data will kind of give us an idea of which direction we're going to go. And I think it's really important to emphasize that we're not yet at the point where businesses and individuals can let up on using our layered mitigation strategies every single day. What has not changed is that this layered mitigation approach helps prevent spread, and this will help with variants. This will help with actually working towards opening schools and businesses and they work in whether you're in public or private settings. And the more layers of cheese you use, the less likely the virus is going to get through them. So layer up as much as you can. I mean, I can see the light at the end of the tunnel and it's getting closer, but we're not right there yet. So if we can, please don't let down your guard right now and keep doing everything you can do so that in a few months when the supply of vaccines are available and we can get most adults vaccinated, we'll be, I think, in a much different discussion point by the beginning of summer. So hopefully. And that's it. Uh-oh. Nikki, I hear you, Lisa.
Sorry.
That's okay.
Anybody have any questions for Katrina? And I just said nothing? Nobody?
Yeah, I have it's not so much a question as it is an observation and a recommendation. I think that Katrina has done a good job of providing the information. If you go back and we don't have to do it, but if you go back, which I think most of us have seen this before, what I'm suggesting very strongly is that the data we have does not indicate that the recent relaxation of even the slight reduction in restrictions that we have are not warranted by the data at all. I believe that the advice and also, very frankly, the experience that we've had in this state about what to do and when to do it has been ignored for the March 1 announcement. I'd like to suggest that this board, at the very least, realizing our limitations, just strongly recommend that people adhere to the restrictions and requirements that were set prior to March 1. Just stop right there for another 2 weeks and see what's going on. And I'm not saying this because I think that Littleton has to set the pace. I think you'll find that the that the same risk, that it's just as simply a risk, is being, shall we say, confronted by all the towns around us. And to think that that those towns can relax does not make a lot of sense, because as we keep trying to remind each other, this virus does not obey it comes, if you want to just look at it, if the sewage tests in Boston Harbor start spiking up, which they are, then all you have to do is wait 2 weeks and they arrive here. The virus just comes here. It's not under control. And if you look at our vaccination rate, it's way, way too low to even have significance in breaking chains of transmission, except if you're just very, 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 very lucky. And I haven't put enough varies on it yet. The second is the spread of the South African and the UK virus in Massachusetts is not known. Those numbers are the result of very limited sampling. We can't track these variants because we're too busy tracking other things. So that could be off by 100% and we wouldn't know it. Or it could be accurate. We would not know. The data are not strong enough to indicate what the spread of that one is. So for all intents and purposes, it could very well be it now dominates. I don't know how close to domination it is. It probably needs another 2 weeks if it has a normal expansion curve. So I just like to recommend, even if it sends a signal, that we are concerned enough to recommend that the town of Littleton at least recommend it, that please, don't advance to the March 1 or whatever it is announcement for at least another 2 weeks. Make it voluntary, make it clear we're recommending.
I actually agree really with that. I think that he's opened things up way too fast. So I guess that would be up to Jim too. Like the inspections you were saying, Jim, that you're going to have to do. Is that something that we can do as a board to not? I know Somerville is doing that too, right? Not following, or Boston's not following what Massachusetts is following, something like that.
I believe they're doing it by public health order. So theirs isn't a recommendation. It's by order, I believe.
Mm-hmm. So you're just recommending it, Mike?
Yeah, I've been impressed by the ability of the residents, not only of Littleton, but of the other towns, because as Katrina has shown in the data, I mean, the rest of the towns aren't that different from us. Some of them are larger and they seem to be, quote, holding their own, as it were. So I'm trying to get across the notion. I'm more interested not so much in the specifics of the, are we listening to the governor or not? That's not the issue. The issue for me is to convey to business owners, restaurateurs, everyone who has to deal with the public or would like to deal with the public, that we strongly recommend that they maintain heightened, shall we say, awareness and caution, and use the up to the February 28th, shall we say, recommendations of the CDC. And I'd just like to point out, it is the CDC, by the way, which has also recommended that these openings not occur quite yet. I mean, I realize we're not at the scale of Texas or Mississippi, which are ripping off their masks and, I guess, celebrating something. But this is a situation which we can learn what the trend is very quickly. It's another 2 weeks. That's all we're really asking them to do. So when Jim goes around, I'm not asking him to say, okay, this is on order. I'm going to ask basically that to convey to them that Littleton's own Board of Health strongly recommends that they not expand out, not take the vigorous action that shall we say, seems to be permitted under the March 1 announcements, that they should follow more closely the CDC recommendation, which is hold fast and be wary. And we'll be the first ones to celebrate, go for it, when we see the information. I hope we're wrong. I hope nothing happens in the next 2 weeks. So it's a recommendation.
Why don't we just make it an order? Can we do that?
It's my opinion that the order won't really, it's the order, even though it's an order, I think Jim will be the first one to admit that it takes a major effort on his part and his team to enforce.
And I guess one of the things as you're looking at the order, your numbers are dropping. The state's kind of going in the opposite direction that you're going in. Not to say that it wouldn't work, but to Mike's point about enforcement, they're seeing the state saying one thing. A lot of some of the big cities like Somerville, Cambridge, they put those orders in when their numbers are going crazy, and they've had this order that they can kind of work back and forth with. Where you have really followed the state's order and followed the way the state has gone up and down with their openings. So,
Yeah.
Again, I'm just going to repeat.
Yeah.
I'm going to make it a recommendation, basically just as an extension of common sense, that we're seeing a flattening, not a decline.
Mm-hmm.
And we've seen these flattenings before, and the flattening is followed just about I don't know of any time yet, maybe Katrina can correct me. Every time a flattening we've seen goes in the opposite direction 2 or 3 weeks later and climbs. And with the variant around and the vaccine still not distributed widely, we're still playing very high risk baseball here. That's the
We're
message.
still not back at the same levels we were last summer or even early fall too. Like, I know we've declined a lot since January, but we're still riding in mid-fall, late fall levels. We're still having a lot more virus circulating. So I don't know what from a policy and recommendation point you guys are doing, but from a public perception, it looks great because we fell so far, but we had really far to fall. So I would love to see our numbers get down further before we do more reopening, but that's a choice you guys are making clearly.
Okay. Jim, do you anything to add to that
So
at
we
all,
can
or-
certainly, as we're out and about doing inspections, we can certainly, and I'll actually put something together in writing to provide to the owners, picking up on the CDC's notation that, this is kind of tenuous times and we're nowhere winning on this thing here. We're holding our own and hoping that we work fast enough to get ahead of it, and that we'd really like you to follow these, certainly follow the guidances that we've all been talking about to the fullest extent of all of those recommendations, but actually just stick to those other occupancy rates prior to March 1st.
Yeah. Okay. All right. Anything else to add to this, guys? All right. I think that's a good recommendation, Mike. I wish we could enforce it. So, all right. Anything else for COVID? All right. So let's move on to the next discussion about the weekly versus twice monthly Littleton Board of Health meetings. Anybody have an opinion?
Well, I mean, after what we just recommended, I think we're going to have to keep our weekly meetings going. In fact, that should be a clear signal that we should take a deep breath. And, if I hope Katrina can make the weekly meetings and we can continue to take an early look and talk to our colleagues in other towns and all the rest and get reports back from the field from Jim. I think we should keep going on a weekly basis until, again, the vaccine levels are still not, we're still nowhere near the level of people vaccinated in the state, much less around here, to say that we're in what we'll call a control inflection point. We're not there.
I'm fine with doing it once a week still too. I know,
Yeah, I agree with that.
I think the other thing too, not just with our what we've recommended, but the fact that there are changes in what the state is recommending for capacity and reopening and stuff like that, that we should keep an eye on that too and see how that's going. And if it's going up, then we still need to be meeting regularly. So, okay. Do we need to take a vote on this, or should we just continue meeting weekly?
Yeah, we're not changing anything.
Okay. All right. All right. Great. All right. Thanks very much. And Jim and Katrina, can you guys still make it every week? You're on mute, Jim.
Yeah, I have just that conflict with the Boxborough Board of Health meeting, but otherwise I'm fine.
Okay. And is that every other week, Jim?
It's just once a month on a Wednesday.
Okay. And you let me know.
Yep.
Okay. Awesome. Great.
I already
Thanks,
penciled
Jim.
you in for the month.
All right. All right. Thank you very much.
Alrighty.
You're welcome.
Thanks. And then next, the discussion with the public input regarding the proposal to create a new full-time position for the local health agent.
Excuse me, I'm sorry to interrupt, but we're not looking for a health agent.
Okay.
My understanding is we're looking for a public health director.
I thought this description I got from Ed, and I thought that that graph that he put out had a health agent.
That's
on.
yeah, but Ed,
Want to change the title?
yeah, Ed's pursuing a different line than we are, I think.
You want it, not the position, but the title.
Yeah, I think in order to get the kind of professionalism that we become used to, whether or not, due to Neshoba's efforts, Jim's efforts, I believe that if we're going to look, we need to look at least at the level that Jim is at. That is competence. And so that's a public health, as opposed to what's described there as someone who does basically works for a public health director. That's someone who goes, it's basically a sanatorium. That's someone who goes around and performs basically the inspections and recommendations regarding septic systems.
That's what a sanatorium is called.
That's, yes.
So you're proposing a public health agent?
I'm proposing that we're looking for a director of public health. There's no mention here of public health. It just says health. Okay. And that's not what we're trying to do. That's not what we're doing as an alternative to Neshoba. What you have here is not an alternative to Neshoba. It's 2 levels down at least. Okay.
Mm-hmm.
We're looking for someone who has the professional knowledge and competence to not only, because as we all know now, we are an extension of the Department of Public Health of the Commonwealth. Okay, and so therefore there are certain professional standards that have to be met by the public health director or whoever's responsible for public health directly, public health in this town.
Right. Anybody else have anything about this so we need to, what did you say, Mike? You said something about it's not a full-time position, or?
No. I didn't say anything about full-time, all right? That's a classification given that full-time employee at FTE, that's a designation that's only given probably at the direction of the select board and others, and is administered, I think, by the personnel department. So how a director of public health is classified in Littleton still needs, as it were, discussion and a decision jointly. So all we're talking about here is to create, okay, to create an office that would give us the ability to basically fulfill the responsibilities of public health to the town.
You had your hand up, Kevin?
Yes, I agree with Mike, and I had taken a read of that job description, that sample that was sent over, and I think it's very well thought out and thorough, and there could probably be some tweaks and edits just based on what Littleton needs, but I think we're headed in the right direction there.
I believe the one you're talking about is the one that I sent you.
It was forwarded by Janet.
Yeah.
Janet sent it around.
Yeah, I believe I cribbed that
Okay.
from another town's search.
Yeah, it was great.
It worked for them.
Okay. So, I've never done this before, guys. So what's the next step that we do? Should we, do we go to select, or we just keep on discussing this?
I suggest that, I don't mean to do all the, come on, Kevin, Louise, or,
What's
you
the
know,
verbiage?
I mean, I'm getting battle fatigue here.
I would make a motion to put forth a proposal to create a new full-time employee position as a health director of the town of Littleton, public health director,
Director of Public Health.
director of public health of the town of Littleton.
Second, anybody want to second that motion?
I second.
Thanks,
Don't
Dina.
shut me,
Sorry?
don't shut me off. You put me off before.
No, I haven't.
You muted, Gino.
No. All right, so we'll do a roll call. Kevin Baker,
Kevin Baker, yes.
Gino Fratelloni,
Gino, yes.
Louise Nichols,
Louise Nichols, yes.
Mike Zeldin,
Mike Selden, yes.
and Lisa Flanagan, yes. Okay,
Can I make a suggestion then?
yeah,
Yeah,
Please.
this is just a follow-up that we put together as quickly as possible, a very brief letter to the Board of Selectmen and the town administrator, Uncle Anthony, and just advise them that we've looked at basically a summary of where we're heading, and more importantly, why we are heading in that direction. And we're looking forward to their input and engage, as well as that of the public in the near future.
Janet, can you help me with that?
Oh, boy.
Did you say, okay,
Are you okay, Gino?
Yeah. What?
okay, all right, great. Anybody have any correspondence at all? Louise, you and I received something from Steve Gentili about the potential solve. So I don't know if you guys know that it's a couple of Littleton residents that that are being bothered by the noise at the temple, and one of the residents came up with a potential solve with some padded blankets by a company called Echo Barrier. I don't know if, do I have to read this, Louise, or?
A letter?
Yeah.
I don't know.
Okay.
Did the temple agree to that?
No,
No.
they haven't.
Go ahead,
They-
Louise.
He hasn't brought it to the temple's attention yet. He was just telling us about it.
Mhm.
And he put together a slide presentation to show to the temple.
Oh, cool.
Looks pretty awesome.
Nice.
Yeah, yeah.
It seems like a great solution if he gets some feedback from people that have done it.
Yeah, I'm wondering if, so they saw this, this sound attenuation device in, where is it, Concord or Minuteman Bike Path, back of the buildings. And it would be interesting to see if they had a noise complaint, and see if it worked, well for them. So I don't know, Steve's not on, is Steve on the board on the meeting tonight by any chance?
No, he's not. But what it is you have these like blankets. They're maybe like 3 by 4 maybe, and you attach them to fencing. That's it. Pretty
Yeah.
easy.
What do they look like?
They're green.
They're not like moving blankets, but I can forward.
Yeah, they're like mats. They're,
They're called
Yeah.
acoustic dampers.
They're by a company called, you can look this up, Kevin, Echo Barrier.
Yes.
Expo barrier.
Echo Barriers.
If you look up the ceiling, if you ever go into these big auditoriums or venues where music is played, look up the ceiling or on the walls, you'll see equipment like that.
Mhm. Yep. So anyway, Steve's done already just done an amazing amount of research on it. So I hope we can get somewhere with that. So,
yeah.
all right. Anybody else?
Oh,
Have any-
is Jim still here? We could have asked him about the readings. Shoot.
I can text. He said that he was still around. All right. I'll just send him a text, see if he can come back. Let's see. So anybody else has anything else that they've heard about? Any have no correspondence? And then, no? Janet, what's up with the minutes? Did you talk to Diane Ferrari about those?
Diane has not had time to do any of them, so I will provide them to you as I can get them done.
Okay. So, no minutes to do tonight, guys. Any member comments at all? Nobody?
I really like Mike's recommendation and that everybody just be vigilant and be careful and stop the spread. And, you know, what's a couple more weeks? It's been a year, you know?
Yeah.
So.
Yeah. What will you do when you can do it? I don't know. I kind of like this.
Excuse me, what is it you think you can do now?
No, nothing. But I'm just like, what will you do? What will you do when you can? So, all right. No other member comments? Gino, Louise?
Thank you, no.
Nothing.
Okay. And
Be safe.
any public comments? Nope. And Jim's in the participants. Dave, can we have him come back? Oh, I wanted to say something else too. After we talk to Jim. Hi, Jim. Go ahead, Louise. Did you want to ask Jim about the temple?
Jim, I don't know if you saw the email from Steve Gentili today about those Echo Boost panels, and he did a slide presentation. And well, he didn't do a slide presentation, but he had attached a slide presentation to send to the temple.
Okay.
No, I don't see his address on the
Oh,
email.
he was- okay. So
Yeah.
anyways, I'm just wondering the status of all the readings that were going to happen.
So it's kind of a weird situation and I'm kind of in the middle of it. So there is the church, I think, would like to resolve the matter. And so they have a proposal out that I guess I was supposed to pass on to people, to the parties involved. And I guess I wanted to do a little bit of research. In there was the quote from the sound engineers to correct the problem. So I wanted to start there first and chat with those folks and see what it is they were proposing and how it might affect that. Then talk to the temple. Again, it's a strange position I'm being put in. The temple sounds like it's offering some kind of resolution to this, but through us, which is kind of a strange way to do it. So once I talked to the HVAC company, then I think I'm going to check with the temple and say, if this is a proposal that you have, why don't you present it to the abutters yourself? I don't know that we necessarily need to be in the middle of it. So that's kind of where that's at. And as things have been pretty busy, I haven't had a chance to talk to the sound folks, but just to let you know, things are happening in the background. I think, like I said, I think the temple wants to resolve it. So.
Well, that's good news.
I bet they'll be happy as long as they're willing to resolve it.
That's right. So it's always, and again, I have a sense of how you deaden sound and how people have deadened sound, that it's been a complaint. Whether this proposal, I mean, it's essentially an invoice saying we're going to do this, 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 and this. I'd like to talk to them to find out what all of those things mean as I'm standing there looking at the building. Are they moving the fan? A lot of times people will put sound deadening walls around it. I just don't know enough to be able to even speak to it. So, I mean, where the numbers are so close from a statutory standpoint, I don't think they need to do much for them to bring that sound down to underneath the 10 decibels. But again, I just don't have a sense of what their proposal means relative to the sound.
So you've talked to their sound engineer?
I have not. That's the only thing kind of holding this up. I want to talk to them first, just so I understand what it is they're proposing.
Yeah.
So yeah, the abutters ask me, I don't sound so unintelligent about it to say, geez, I don't know.
Well, should I forward you that email about the Echo Boost panel things?
No, absolutely. I hadn't seen it. I think I saw an email from Steve, I guess, Mr. Gentili.
Yeah.
But I don't know that there was a presentation attached to it.
Okay, I'm going to forward the email to you.
Okay.
Louise, can you get in touch with Steve and tell him that some gears are in motion once we're done? All right, thanks for coming back, Jim.
Nope, no problem. Anything else?
Anybody else? Nope.
Okay.
Almost. All right, thanks.
All righty. Good night.
Good night.
Thank you, Jim.
Thank you, Jim.
Good night.
And I just wanted to say something because I saw Justin's on the in the meeting tonight. Justin, did you want to say anything? I had just a quick little text conversation with Mike this afternoon about the testing.
Hi. No, I'm good. I'm kind of taking the night off from participating in meetings.
Okay,
And
no worries.
enjoyed listening to the update on the health metrics, and we'll just watch the data continue to hopefully improve and learn more about what that data means. So thanks very much for all your work.
No, thank you. So I have I got a text. I was asking Mike about the pool testing today, and it says so far so good. Only the second week, but the process is pretty smooth in each school on Mondays and Thursdays. The lab has been consistently returning the results approximately 24 hours. 3 pools done, 0 positives, and the 4th one will be collected tomorrow. So sounds like it's going well. So that's awesome.
Yeah, I think it is going well, and I believe it's like what is it? Seminar announcement? Yeah, there's like I guess it's probably a Zoom meeting tomorrow.
Open
Tomorrow
forum.
Yeah, thank you. Take the
Welcome.
words from me, please. And then the following night, there's a follow-up Q&A. Is that Katrina that just chimed in?
It's me. Tonight is the one that the CIC group, the testing group who's doing our testing, is doing a webinar. And so that was tonight. And then on tomorrow night, the school's doing an open forum to answer questions. And I know they've been preparing for it. They have a lot of good stuff lined up to help families understand and learn about the process. So
Awesome. I must have got my dates mixed up. Do you have any idea how many people attended tonight's meeting? I'm assuming it started at 7 and we missed it, but.
So I registered for the for it because they said they'd send it out later, and I was hoping it would be shareable. So I'll share it with you. But I think the CIC people were doing it for everyone who they're doing testing with. So it was like a broader group.
So it wasn't town specific. Got it.
Yeah, it's not town specific. So when, assuming they do share their presentation, I will absolutely send it to you, Justin.
Okay, great. And I'll try to get the word out tomorrow about the sort of the Q&A follow-up. That's just Littleton specific, right?
That is just Littleton specific. It won't be recorded. So if people have questions, it's really important to show up and be there. I actually asked Lynn that question because I wasn't sure what the plan was. So it will not be recorded to watch later. So it's important people get out tomorrow to listen to it live.
Okay, thanks.
That's a Zoom with the,
Yeah, I think it's a Google Meet, actually, through the schools. Dorothy Malone sent the email to the entire school community. I'm sure between Justin and myself, we can pepper the Facebook pages to get it into parents' hands.
what about those of us that don't have children in school?
We can, I'm sure it's live. We can
Share it
get for
live?
you. Yeah, I'll get you the link. I'm sure that's fine.
Okay, great.
Let me find
Thank
it.
you.
No problem.
All right. And still no public comments, no hands up? Okay. Anybody want to make a motion to adjourn?
Oh,
Make a motion to adjourn.
before we adjourn, are you?
Oh,
gonna-
that's right. We need to do the next meeting. Sorry.
Lisa, are you going to put together the letter please put the letter together or outline one that you'd like to see to go to the Board of Selectmen?
Yep. Janet said that she would help me with that.
Okay, I'll be happy to sort of help you out with that as clerk.
I'll take any of your help, Mike.
Okay, let me know.
Okay. And then, so we're going to continue to meet every week for a little bit longer, make sure that everything goes well. So with the reopenings, so the next meeting will be March 10th at 7:00. Okay. And so Gino has a motion to adjourn. Anybody want a second?
I'll second it.
Thank you. So do roll call, Kevin Baker.
Kevin Baker, yes.
Thank you. Gino Farloni,
Yes. Gina Ferroni, yes.
Louise Nichols,
Louise Nichols, yes.
Mike Zeldin,
Mike Selden, yes.
and Lisa Flanagan. Yes. All right. Thanks, everybody.
Thank you,
You too.
everybody.
Have a good weekend.